Welcome, everyone. Welcome to Monetary Memos YouTube channel. And the 2026 Medicare Open Enrollment period is here, running from October 15th to December 7th. For many, Medicare Advantage plans seem like a great deal with their low or even $0 premiums and attractive extras like dental and vision. But beneath the surface of these perks are potential pitfalls, what we're calling hidden enrollment traps that can leave beneficiaries frustrated and facing unexpected costs. The Centers for Medicare and Medicaid Services, or CMS, is making several critical rule changes for 2026 that you need to be aware of. This video will walk you through these traps and changes so you can make an informed decision. Let's dive in. The single biggest trap isn't just about the plans themselves. It's about what you give up when you choose Medicare Advantage. This is the Medigap time bomb. If you enroll in an MA plan when you first become eligible for Medicare, you might lose your guaranteed right to purchase a Medigap policy later. Original Medicare with a Medigap supplement offers much more flexibility, allowing you to see almost any doctor in the country who accepts Medicare and generally covers the 20% Original Medicare doesn't pay. The trap. If you decide after a year or two that your MA plan isn't working, perhaps your doctor leaves the network, or you get a serious diagnosis, and you want to switch back to Original Medicare and buy a Medigap plan, insurers can use medical underwriting in most states. They can deny you coverage or charge you exorbitant premiums based on pre-existing health conditions. You have a one-time open enrollment period for Medigap when you first turn 65 and enroll in Part B. Missing that window can be a permanent and costly mistake. Prior authorization has long been a sticking point with Medicare Advantage. It's the process where your doctor must get the insurer's approval before a service is covered. This often leads to frustrating delays in necessary care. For 2026, CMS is introducing new rules to improve transparency and speed up decisions. The new rules mandate that MA plans must respond to routine requests within 7 calendar days and urgent requests within 72 hours. While this aims to reduce wait times, prior authorization remains a tool plans use to manage costs. Starting in 2026, plans must also give a clear reason for any denial, which should help make the appeals process easier. In a new twist, Original Medicare is also starting a prior authorization pilot program in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. If you're in an MA plan, look at the plan's prior authorization metrics. High denial rates are a clear warning sign. Original Medicare offers a massive provider network. Medicare Advantage plans, however, limit you to a specific network. If you go out of network, you'll pay significantly more or even the full bill. For 2026, some major insurers are pulling out of certain markets, meaning some enrollees will automatically lose their plan or network coverage. You need to check your annual Notice of Change (ANOC) letter very carefully. It is your most important document right now. Another trap. Provider directories can have errors. CMS is trying to fix this by adding more network data to the official Medicare Plan Finder tool. If you use the Medicare Plan Finder during enrollment and discover after your coverage starts that the information was wrong, you'll be eligible for a special one-time enrollment period in 2026 to switch plans. But don't rely on this. Call your doctor's office and the insurance company directly to verify they will be in network for 2026 before you enroll. The phrase "zero premium Medicare Advantage plan" is attractive, but it doesn't mean free health care. You still have to pay your standard Medicare Part B premium, which is increasing for 2026. The standard Part B premium is jumping nearly 10% to $202.90 per month in 2026, up from $185 in 2025. The annual deductible is also rising to $283. For MA enrollees, out-of-pocket costs can add up. The maximum annual out-of-pocket limit for in-network services is decreasing slightly to $9,250 in 2026. This is your medical MOOP. Separately, your Part D prescription drug costs are also capped. The annual out-of-pocket drug cap is rising to $2,100 in 2026. The maximum deductible for Part D plans is increasing to $615. However, there is good news. Lower Medicare negotiated prices on 10 high-cost drugs for conditions like arthritis, cancer, and diabetes are kicking in for 2026, which should save millions of beneficiaries money at the pharmacy counter. Look beyond the low monthly premium and evaluate potential copays, deductibles, and the overall maximum out-of-pocket limits when comparing plans. Only look at the total risk. Navigating Medicare Advantage in 2026 requires diligence. Don't fall into the traps we discussed without doing your homework. Here's your final action plan. Review your ANOC. Compare objectively on the Medicare Plan Compare tool and seek unbiased help from your local SHIP office. Medicare coverage is personal. By being informed about these potential traps and the 2026 rule changes, you can ensure you have the coverage and peace of mind you deserve. Thanks for watching.